and we are having this via Zoom. And today is our International Day of the Girl Child. So this is a really, really, really important session. We've had various activities going on across the world today in honor of the girl child. Pipi Nana. And the topic for today is empowering the girl child, policies and programs for menstrual health and hygiene in Africa. That is our topic or our theme for today. This is the agenda for today. We started off with the platform being opened. We've been fellowshipping. Some of us have caught up with old friends or old mentors. We've also done our housekeeping. The session has been called to order, and we would now move on to the welcome address or opening remarks by Rotarian Dr. Nana Agyemang-Mensah. Then from 4:15 to 5:30, we would have the presentation by our resource persons or the panelists. We have 5 resource persons and panelists: Dr. Dinah, we have Lishan, Miss Ellen, Miss Zandile, and Dr. Edmond. They would each have 15 minutes. And from there, we would now have the questions and answers, any comments and inputs from the participants. Then at 5:50, we would now take the next steps and see how we would move on from there. And by 6 p.m. GMT, we would close the session. And as I said earlier, my name is Gertrude Ajo Apalu, and I'm a past assistant governor of District 9102, and also a member of the Rotary Club of Accra East, Ghana. Pipi Nana.
Pipi Nana, you are host, you can unmute yourself.
Unmute, please.
Yes, are you ready?
Okay, thank you.
Okay, so before Pipi Nana gives us the opening, yes, before you give the opening remarks, just quickly to go through for those who do not know you. So Dr. Nana Agyemang-Mensah is a gender and development consultant. She's a charter member, the past president of the Rotary Club of Accra Airports, Ghana District 9102, and also the first female Rotary Club president in Ghana. She has a multifaceted training in sociology, agency counseling, adult non-formal education, community resource development, and gender studies. She also worked as a consultant for UN agencies, the World Bank, government ministries, development agencies, and NGOs, carrying out capacity building, training, and research in a variety of sectors such as education, food and agriculture, water and sanitation, women and adolescents' sexual, reproductive, and reproductive health rights, child rights, human rights, gender mainstreaming, and women empowerment. She was the country director of the Hunger Project Ghana for 13 years, where amongst others, she introduced a woman empowerment project, which was adopted and replicated in all 7 other program countries. Prior to joining the Hunger Project, she was a senior counselor for the National Council on Women and Development, NCWD, where she was in charge of advocacy and represented the council on several intersectoral committees. Participants on the call, kindly join me to welcome the convener for this session, Rotarian past president, Dr. Nana Agyemang-Mensah. Pipi Nana, past president Nana, the floor is yours for the open and welcome remarks. Thank you.
Before Pipi Nana takes up, let us welcome IPDG Yon, who just joined.
Wait. Welcome, IPDG.
Thank you, PAG Ajo, Rotary leaders, development partners, government officials, fellow Rotarians, Rotaractors, the media, if any, distinguished guests, ladies and gentlemen. Today is the International Day of the Girl Child, a day set aside to address the challenges girls face in their everyday lives, promote their empowerment and the fulfillment of their human rights. The theme this year is Digital Generation, Our Generation. Obviously, an attempt at bridging the digital gender divide. Please forgive me for my lack of excitement, but the global internet user gender gap is 3% in our part of the world, while the percentage of females among science, technology, engineering, and math, that's STEM, EM graduates, is below 15% in over 2/3 of countries worldwide. If at this stage in our development process, many of our girls have to miss school because they are in their period, and for some, a total of about 50 to 60 school days in the year is lost due to unavailability of appropriate water, sanitation, and hygiene services in schools and communities, inaccessibility of safe, affordable, and sustainable menstrual hygiene management products, then we have a problem. Ingrained negative social norms and beliefs about menstruation, please forgive my voice, which stigmatize and thus erode the self-esteem and mental well-being of our girls well into their adult years, also do have relevance for school attainment by girls and economic progress. Fellow Rotarians and friends, the Sustainable Development Goals, which all our participating countries have acceded to, as our yardstick for comprehensive and progressive development, supports the assertion that it is only by ensuring the rights of women and girls across all the 17 goals that we will attain an inclusion, economies that work for all, and sustain our shared environment now and for generations. Here are some specifics with regards to the SDGs. SDG 6.2 says we should achieve access to adequate and equitable sanitation and hygiene for all, paying attention to the needs of women and girls and those in vulnerable situations. SDG 3.7 says we should ensure access to sexual and reproductive health care services. 5.6 says we should ensure universal access to sexual and reproductive health rights as agreed. SDG 4 says ensure inclusive and equitable quality education and promote life learning opportunities for all. 5.1 says end all forms of discrimination against all women and girls everywhere. 8 says promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. 12.4 says achieve environmental management of chemicals and all waste. And 12.5 says substantially reduce waste generation through prevention, reduction, recycling, and reuse. Fellow Rotarians, development partners, and friends, as we listen to the panelists, what steps are being taken to promote menstrual health and hygiene in our various countries, do let us pay attention to the extent to which SDG requirements have been aligned to the respective country policies and programs. For instance, what is the current situation of girls and what issues have accounted for the policies put in place? Are the policies appropriate and well-intentioned for implementation? Are specific budgetary allocations tied to these policies such that they can be expected to be released to ensure effective program delivery? Which specific designated agencies are responsible And how accountable are they and to whom? This forum is an opportunity for learning and cross-fertilization of ideas across different countries and clubs to provide for better service to our communities. It is an opportunity for identifying potentially effective alliances and partnerships across board. As Rotarians and Rotaractors, let us see how we as Rotary clubs or the Rotary Action Group for Menstrual Health and Hygiene can fit within the scheme of things to be able to effectively support the work of our governments. We need to be seen as partners and not as competitors or adversaries. Let's identify the key issues affecting girls, identify the gaps in current performance, and thereby be able to highlight the areas of dire need on which clubs, and indeed as an action group, we can agree to focus our activities. Let's identify trends, if any, acceptance of products for menstrual hygiene management. Let's identify potential partnerships with government agencies, development partners, and between our Rotary districts and clubs. And finally, but not the least, let's examine how we can instill some synergy into our club activities by strategizing on ways to maximize our diverse resources for optimum impact, either to our clubs or as collaborating clubs in response to the Rotary Foundation's interest in supporting programs of scale. Can we, for instance, work towards multiple country projects? As government representatives here, how do we view Rotary government partnerships? How can the existing relationships between us that are ongoing be deepened and expanded? And how can this new area of girl-child empowerment in menstrual health and hygiene or menstrual health management be explored for optimum mutual benefit, as has been done with polio eradication and other WASH service delivery projects, such as is ongoing in Ghana and Uganda, I know, and I'm sure other parts. As development partners, how do we see ourselves collaborating more? I mean, as development partners, as NGOs, how do we see ourselves collaborating more actively? These are a few thoughts I'd like us to chew on as we get ready to listen to our main speakers. Fellow Rotarians, I thank you very much for kind attention.
Thank you very much, Past President Dr. Nana Ajiman Mensah, for the welcome address. So would now kindly like to move on to our panelists. And we would like to start with our first panelist. And I think I would need to share my screen again so we can see who we are going to be speaking to, listening to. Okay. Second. Okay, so our first panelist or first resource person is, one second, sorry about that, is Dr. Dinah Nakiganda Busiku. She's the Assistant Commissioner, Adolescent and School Health of the Ministry of Health, Uganda. Dr. Dinah believes in empowering and supporting adolescents and young people to reach their fullest potential. She believes that keeping young men and women in school and skinning those out of school is the best way this can be attained. She's a public health specialist, yes, one of my colleagues from the University of Sydney, Australia. She has a postgraduate diploma in sexual reproductive health from the University of Lund, Sweden. And she's the chair of the Adolescent Working Group at the Ministry of Health in Uganda, co-chair of MHM Steering Committee, and the chair of the Self-Care Expert Working Group, and a member of the FP 2030 Country Donor Focal Point Committee. Participants, fellow Rotarians, Rotaractors, our partners in service, kindly welcome Dr. Dinah, who will be speaking to us and giving us some refreshing insights as to what she has been doing so far. Dr. Dinah, kindly, the audience is yours.
Thank you very much for the introduction. May I please be allowed to share my slides, my screen?
Yes, you can share.
Thank you. Okay, here we go. I have very few slides to present to share with us all. And this was really in guidance from the organizers. Good evening, good morning, and good night to all of us. And my presentation really is around empowering the girl child and looking at the menstrual health and hygiene policies and programs in Africa. Sorry, there was a typo there. So here we'll basically focus on the policies that are in place and some of the prevailing issues that have accounted for the evolution of the policies in Uganda. And like we have heard from other countries, or like we will hear, we have a national menstrual health hygiene management plan in Uganda that will run from 2021 to 2025. And this has three main objectives, namely, one, to help us to define a national direction. And this means for all stakeholders in this kind of line in menstrual health management, stakeholders ranging from health, education, the private sector, but also the different CSOs and the non-government organizations. And then two, the plan would really help us to coordinate the different activities that we carry out as a country, both within the private and public sector. And lastly, the third objective of the plan is to document lessons from the various interventions that have been done by the different stakeholders. We know, for example, that Rotary is supporting various menstrual hygiene management practices in country, but we also know that different government agencies, the Ministry of Health is doing some bit of work, the Education Ministry, same for the various WASH sectors in the country. So we know that the third objective would really help us to learn and kind of come up with a national position. And like we have said, we have a steering committee that really looks to run through the various activities for this strategic plan and kind of monitor and ensure that everything that is written there is followed to the dot. But that said, that is not a policy per se, but that is the main guidance document that Uganda has in regards to menstrual hygiene management. We also have a National Development Plan 3 that runs from 2020 to 2025. And the MHM strategic plan is in line with the broader objectives of this NDP3, which aims to enhance the productivity and social well-being of the population, of course, mainly focusing on the young people. And one of the key issues that we identify as key is the menstrual health and hygiene management. The policy also that in the same line is the environmental health policy. And of course, this really emphasizes the response to the differing needs of men, women, and children, while recognizing that women are the main users of water and sanitation facilities. It also further recognizes the fact that sanitation is essential for improving women's dignity. So here we will look to see that the men have a role to play and the children as well, same for the women. So the environmental policy really brings this out very well. More about policies, we have the Uganda Second National Health Policy, and its purpose is to attain a good standard of health for all people in Uganda in order to promote a healthy and productive life. And of course, again, this speaks to productivity and health of all people, women inclusive. And last but not least is the Water and Sanitation Gender Strategy, which is running up to 2022. And this aims to empower men, women, boys, girls, and vulnerable groups through ensuring equity in access and control of resources in the water and sanitation subsector. So these policies are really trying to get us in line of what else is existing outside the National Strategic Plan for Menstrual Health and Hygiene, but we also are really aligned into the various existing policies at the country. So the other area that we want to talk about this evening is, so what are the prevailing issues that have accounted for the evolution of all these policies? Of course, they are quite enormous, but I kind of chose out which were the salient ones. And one is it is recognized that families, communities, and schools have not been adequately provided menstrual hygiene management. And just to mention that I will use menstrual hygiene management and menstrual health and hygiene concurrently or to mean the same. And we realize that this guidance is still very minimal or inadequate. And we also realize that sanitation facilities and materials for girls and women are lacking in most of these places, the families and the communities, but also in the schools. And this makes it difficult for them to adapt to their body changes and the external environment. One of the other issues that is prevailing is that there is limited access to friendly health and other social services and information by adolescents, especially on menstrual hygiene management. So many times when you talk about adolescent health and social services, people would quickly run to the broader areas of sexual reproductive health or mental health, but they don't really go down to look at what is it that we need to do for menstrual hygiene and health. So we also found that this is one of the big issues that we need to address. But then we also realized that there is lots of non-functionality of the WASH structures in most schools and mainly in the public schools. Of course, with advocacy, many of the private sector schools have really come up to improve this, but it's still non-functional in most of the public schools. And then we also realize that there is limited engagement and involvement of adolescents in designing, planning, implementation, monitoring, and evaluation of all these MHM activities. So more about the issues, there are also negative social cultural norms and harmful practices related to menstruation, including various taboos. Uganda is such a small country, but with very many tribes, I think around 52 tribes. And you'd find that almost each of these has a taboo regarding menstruation. So with all these, then we really need to work hard to ensure that from all these different areas, we kind of bring them on table and discuss various issues around their taboos and how most of them are myths. And then we also realize that 1 in 10 school-age girls skip school during the menstruation, or they entirely drop out of school because they lack access to the necessary sanitary products. By contrast, the MHM response has largely focused on sanitary materials as a magic bullet, but we know that this will not resolve the whole menstrual challenge for girls and women. And yet, we also need to recognize that menstrual hygiene management is really beyond pads, but it also includes other key areas like advocacy, programming, and changing policies for the girls to entirely benefit. And last but not least, the above barriers really imply that there is inadequate planning, and there is therefore an inadequate response and resource allocation to address menstrual challenges. And this has really persisted over time. So we thank Rotary International for coming up with this presentation so that we all come to table and see how we are going to work on this. So like Nana introduced, so we are looking to see which other policies, are all these policies accompanied by appropriate guidelines for implementation? And yes, Uganda has a menstrual health and hygiene guidelines that was developed in 2017. And we have this for the girls in school, but also out of school. And this ensures that for every young person, they still have access, because if we focus only on the girls in school, then that means the girls out of school would be left out. The beauty about this is that the two sections of the young girls access the guidance. And then also the government of Uganda, through the National Bureau of Standards, has already developed standards for disposable and factory-made reusable parts, apart from all other products that are being, generally made by individuals and small-scale women groups and organizations. We realize that we still have some gaps existing therein, and these are mainly the negative socioeconomic impacts that are partly caused by the limited programming in menstrual health management. But also we see that full implementation of these initiatives is lacking and hampered by resource hindrances. Full implementation means implementing the whole range of the management outside just the products. And then another gap we recognize in this is that there are lots of local pilot projects that are involved, and some of these, the coordination of all these local pilots that have been done by various people can be a problem, and that means some bit of parallel programming, which is not very good for the country. And then around budgets being allocated to these policies, we have some budgets that are mainly the midterm frameworks, and the policies and strategic plans are implemented within the specific budget allocations. However, we realize that there is limited prioritization of some of the programs, and then there is misallocation of some of the resources, even when the budgets are sometimes available. And then there is lack of sector prioritization of menstrual health management. Apart from now, we are bringing up a lot of advocacy on it, but previously, the prioritization for menstrual health management was really not there. And then, like I've mentioned earlier, the parallel implementation of MHM activities in the various sectors is still a very big problem. So the other issue was around which are the designated government agencies responsible and were they accountable? So one of the key agencies that has been very active in Uganda is the Ministry of Education and Sports. And now the Ministry of Health is really also coming up very strongly. And we have a steering committee for the National Steering Committee for the Menstrual Hygiene Management. And I'm glad to announce that my supervisor, Dr. Olaro, chairs this committee. He's a Rotarian from Sondi. And once he's not there, then I co-chair the steering committee for him. So we already have that multi-sectoral engagement with the Ministry of Health here and the Ministry of Education and Sports. But also notably, we have the Ministry of Gender, Labor and Social Development, Ministry of Water and Environment to deal with the WASH issues, and of course, Ministry of Finance and Economic Planning, among others. And all these ministries really are brought together by the Office of the OPM, and there is a designated officer to run through this. The partners in development that we have in this agenda are mainly the UNFPA, UNICEF, UNHCR, WHO, as we can see them all here. And just to say that they are all aligned to particular parts of the country to ensure that there is inclusion of every young person and young child, to ensure that they get all these access, the facilities for menstrual health hygiene. And we also have various civil society organizations and the private sector. I hope Rotary will one day be part of the big organizations, just like it is for Polio Plus. So this table, the next two tables will quickly show us the key strategies that were used and the targets of these key strategies. And the strategies are mainly around community mobilization, sensitization, and awareness. Here we are targeting adolescent girls, their teachers, if they're in school, the health workers, and the community resource-owned persons, religious and cultural leaders. So for each of these target groups, there are specific messages and specific activities that would deal with each of these targets. For example, for the religious and cultural leaders, we will have messages towards changing some of the negative cultural beliefs, and also telling them about MHM as one of the key sexuality and need for young girls, to talk about it freely and not to think through their cultural norms as, as key. Of course, the health workers managing, for example, menstrual pain and to report menstrual difficulties and excessive menstrual health side effects. So the health workers come in there, but also the community resource persons such as the radios and TVs, that should be under media. These ones again help us to give messages to the communities, but also to ensure continued advocacy to the various stakeholders. And then we also have a strategy on empowerment, and this is really towards adolescent girls and their caretakers. Same for community leaders, like I have kind of mentioned in the previous target group. And then the other key strategy is around advocacy. And this is really with development partners, CSOs, NGOs, implementing partners, the private sector, civil and cultural leaders, among others. Then we also have a strategy on targeted social behavior change communication towards adolescent girls, cultural institutions and parents, caretakers, health workers, teachers. And then this really looks to the right of MHM information for the different categories of people at the different levels. Then there is a strategy on capacity building, which is really to develop technical capacity within staff of governance and partners, but also the community members, girls and boys and women together. And lastly, there's a strategy on media campaigns and involvement. I had kind of mentioned this before, and these will really, we need first of all to build their capacity so that they understand what menstrual health and hygiene is, and then they can then give us, they can kind of effectively give out qualified and right information to the public once they have been trained. Then we have a strategy on strengthening school structures, and lastly, public-private partnerships. For the schools, we are hoping that girls and boys, including adult male and female teaching and non-teaching staff, together with their school administrators, can continuously be trained and retrained on how to manage, how to, especially the boys, how to cooperate with girls once they're in their periods. Same for the teachers and the female women female women and male teachers, to ensure that there is some kind of room for girls that has a side kit. That once a child is having their menses, then they can access this facility and life continues on normally for them without being discriminated. Then for the public-private partnerships, the private sector plays a key role, like we are knowing and we know, in the provision of supplies and infrastructure development for MHM. So thank you very much for listening, and that brings my presentation to an end. Thank you.
Well, thank you very much, Dr. Linda. This has been very insightful, and particularly with regards to what has been going on in Uganda and what is also planned. Thank you very much for sharing the insights on how policy should be translated for implementation. And one key aspect is ensuring that the implementation plans are adequately budgeted for, and the resources that are allocated are sufficient to be able to implement these amazing strategies. Looking also, one key thing is how it has to be through multi-sectorial collaboration. It is not just the Ministry of Health or the Ministry of Education. It involves the various sectors, ministries, involves civil society, our development partners, the private, also looking at private-public partnerships, and not forgetting our men and our boys. So thank you very much. If you have any questions or comments, kindly put them in the chat box or note them down. After we listen to our amazing resource persons or panelists, we would have the opportunity now to ask questions or make any comments. So without much ado, I'd like to quickly move on to the next speaker, who is Lashan Kereto. Lashan is a sexual and reproductive health rights advocate and member of the UNFPA Youth Advocacy Panel, Kenya. Lashan is a student leader, a reproductive health advocate, and a member of the Youth Advisory Panel of United Nations Population Fund. He is an active Rotarian in the Rotary Club of Kikuyu. I think, yes, that's a very active club, Lashan. In 2016, he founded Tareto Africa, a community-based organization that is widely involved in sexual and reproductive health rights advocacy, mainly focusing on advocating for sexual and reproductive health rights for girls and adolescents. During the peak of the pandemic in 2020, that led to the increased cases of teenage pregnancy, he launched and successfully ran the Make a Girl Smile initiative through his organization that provided for sanitary pads and sexual and reproductive health education to close to 2,700 girls in Rift Valley region, Kenya. He's the president of the Clinical Medicine Students Association of Kenya and the president of the International Federation of Physician Assistants and Clinical Students. Wow. With the support of UNFPA, he is now uniting all university students in Kenya towards joining the advocacy with the slogan, diversifying advocacy against female genital mutilation through students under the Students Against FGM initiative. And one of his favorite quotes, I quote, "Young people are the custodians and designers of the practice that they would like in their generation," unquote. Lashan, Rotarian Lashan, your audience, we are eager to listen to you, to share your experiences. So over to you now. Thank you.
Yes, thank you. Thank you so much for that introduction. I'm very, very much honored this evening. Good morning, good afternoon, good evening to everyone that is joining us today for this amazing conversation. I am Rotarian Leshan Kireto, as you have been told, and I'm glad to tell you about menstrual health and hygiene policies and programs in Kenya. I serve the Youth Advisory Panel of UNFPA, which is, I'm glad that it's also a very, very big partner in this field. So I'm going to take you through a journey, and we are going to really see and hear from what exactly are these policies in Kenya. I'm glad to be the youngest in the panel, and I hope you're able to really hear from a young person who is both on the ground and also working towards making policies better in Kenya. Yes, so my presentation will be an overview. I'll take you through on what we're going to discuss. The pictures that you'll be seeing are out of the activities we've been doing in Kenya through our organization, Tareto Africa. And we want to go into the ideal situation of menstrual hygiene management. We also want to see the situation analysis based on different data that has been done by various organizations across the country. Then we will also go and see what has been done, what are the policies that are there to be able to really curb the situation. Then we are also going to see what we are doing as CSOs, as Rotary clubs, and more so as young people. We will also see what we can be able to do, and then we will go now and have a pretty end of a presentation. So I have to say that menstruation is the critical indicator of female health and vitality, and a healthy menstrual cycle indicates overall health and well-being. As you heard in my introduction, I'm a clinical medicine student, and one of the very, very important things that we talk about when it comes to girls and women is their menstruation. Their menstruation tells us how is their health and how are they doing well generally. We want to see what is an ideal situation for menstrual hygiene management. I will put it in one statement that I was able to really come up to be able to give you an overview or a general definition of what exactly menstrual hygiene management is. So it is women and girls accessing enough and guiding information using clean menstrual management materials to absorb or collect menstrual blood that can be changed in privacy as often as necessary for the duration of a menstrual period, using soap and water for washing the body as required, and having access to facilities to dispose of used menstrual management materials. Pay very, very key attention to the bold and capitalized words: information, menstrual management materials, also privacy, and often, how often, as well as soap and water and how to dispose of. That way, I'm going to give you a situation analysis based on the data that have been done to give you what exactly is happening in Kenya based on the data that has been given, and then we can go together and find out how we can solve this. Kenya is one of the beautiful countries that I'm really glad to have been born from this country. And you can see our beautiful flag. And the people who make this country amazing is, as per the data that I'm showing you right on my screen, we have a total population of 47.5 million. And we have females being, higher, and with 24.0 million in population. We also have the males as 23.5 million. So you can see the people who are making Kenya what it is, and that is really the general perspective of the population. 50.5% of this population is made up of women and girls, and that significant number of women and girls menstruate every month, and therefore they're exposed to challenges that come with poor menstrual hygiene. I want to go into the situation analysis of what I told you about, and I'm going to start with information. The ideal situation will be able to have accurate and adequate information about, about menstruation right from pre-menarche up to menarche. Research shows that menarche starts for girls averagely at 14.4 years, averagely for different girls. 87.7% of information about menstruation is received to the girls from their mothers. 15.5% is from their teachers. And this really is an important aspect because you are able to manage your menstruation period if you have access to information. This information that is being given is coming from the mothers, and we also have to look into how good are they and how well are they versed with this kind of information. 50% of the girls, based on the research that was done, openly discuss menstruation at home. You can tell that half of them are open to discuss and half of them are not open. In Kenya, and also I know in several African countries, we have this culture of silence where we don't want to talk about some, especially on reproductive health, because we are afraid and we feel that it's a taboo, it's shameful to discuss about this. This has limited the kind of information that is shared to the girls, and you can see that the percentage of the information that is being given, even as it comes from the parent, they are not exactly well versed with the details. Many of them did not get this information as they were growing up, and that with the information that they are passing is also based on the inadequacy that they also received. We are also going to discuss about menstrual management products that are used in this period. Ideally, they're supposed to absorb and collect menstrual blood effectively. Approximately 65% of girls in Kenya cannot afford any brand of sanitary pads on a monthly basis. This is quite a large number, more especially exacerbated by this period of COVID-19, where we've seen a lot of girls really lacking because during the pre-pandemic period, we used to have a lot of girls really receive the pocket money that they get to be able to do their shopping, and that way they can be able to purchase these menstrual management products. Now, during the pandemic, schools are closed. People are not able to access this. There is excess economic struggles across the country. And that way it's been able to make it very, very hard to access these menstrual management products, making the situation even worse. 2/3 of women with no previous puberty education relied on homemade alternatives and more or less likely to know hygiene basics. This was based on a research done in Western Kenya. So in addition to not having education, you are forced to really utilize what are the alternatives that you can be able to utilize to be able to come out of that period effectively. We're also going to see about sanitation. Ideally, you're supposed to have soap and water to be able to really maintain hygiene in this particular period. 60%, based on this research, 60% had accessible water for hand washing and 2% had soap. So the 2% that had soap are lacking because we have water, but we do not have soap. And that's a problem because you need to have both of them for you to really successfully observe hygiene. 24% had access to sanitary facilities in their different schools as well as homes. And so this one is very, very important because this is where privacy comes in. We want to see that there are taps that are different from males and females. This period is a period that girls require privacy to be able to really restore their dignity in this particular period. And that way they can come out really with their self-confidence and their heads high, knowing that they're able to competitively act to be able to study, remain in school, and to work. We want to see about the disposal facilities that are available. Ideally, they're supposed to be safe. Most schools and families use pit latrines to dispose of the menstrual hygiene products. So in rural areas, more of so, that is where we have pit latrines. So that is where, 65% really dispose them there. 50% is in the urban. And this is also quite important because pit latrines are being used for disposal of these products. We need to, that is what is being used, entire largely. And based on my work, as I've been able to move around and be able to help a lot of girls across my region, we've realized that most of the girls, they dispose their sanitary pads in pit latrines. And in a school that probably you have about 500 girls, in a month that pit latrine is full, and that way it becomes very, very hard, for the school in terms of economics to be able to continuously have to really come in and have to take that out from the pit latrines. And you also know that they do not have, especially for the disposable sanitary pads, they do not really, degrade easily. If women and girls are well informed about premenarche, understand their bodies, can access the correct information without shame, they will choose products based on their needs and economic capacity. They will also create demand for the kinds of products they will prefer and drive the market to invest in linked research and development, packaging, or better affordability. This information is to tell you about really what we are supposed to have. That way we are able to channel the direction that we are interested in. Now, getting into the Kenya Menstrual Health Management Policy. I came into this policy and I was able to really analyze it, and I'm going to tell you what exactly and how it's running, and that way you can be able to compare with your country, and we can see possible ways of working together to improve them. We have a national policy whose vision is to enable women and girls to participate fully in daily activities with pride and dignity, without stigma and discrimination, and be able to access education, health, and employment opportunities. Through this, they want to do this with a mission to ensure that all women and girls in Kenya can manage menstruation hygienically, freely, with dignity, without stigma or taboos, and with access to the right educational information on menstrual hygiene management, menstrual products, services, and facilities to safely dispose of menstrual waste. So to achieve this vision, we have to make the situation analysis that I've given you on information on hygiene, that is through soap and water, as well as the menstrual management products, and even safe disposal. So for them to be able to do this, the policy really comes in and tries to handle the policies. This is what the government and also other partners are doing to be able to handle that situation. This is very important because, girls missing out in school and, missing out in employment opportunities by women makes them less competitive in a very, very competitive world that we have today. The Kenya Menstrual Health Management Policy is guided by principles, which are the following. They want to give information and make this notion that menstruation is a human right. It's not something that anyone is not sick. It's not a disease. It's not something that you should be segregated for. It's not something that you should be ashamed of. We also want to give an integrated approach where various stakeholders are brought together, and they are also bringing their expertise on the ground and also in their lines of work to be able to make an integrated approach that really helps the situation. We also have the the water and sanitation programs as a precondition for menstrual hygiene management. Remember that prevention is always better than cure. We want to make sure that this policy wants to make sure that there is enough sanitation even before that period of menstrual, when you have a menstrual period. And that way, it's not like we are rushing to be able to have sanitation when already normally we do not have with these WASH programs. They also want to avail these services equally to everyone. There is also social inclusion, including everyone that cuts across, right from the boys to the men, to teachers, to the religious, institutions, as well as the educational facilities. I'm going to tell you later about the various stakeholders. So this social inclusion is going to make sure that this battle is not only for women, it's for everyone, and that way we can work together towards making this situation better. Also the education through providing of information, and also making sure that these services that I've told you about are sustainably accessed. We also have the bringing on board the private sector, which is quite vast and has lots of experiences and activities they're doing to be able to make sure that this menstrual health management is better every day. There's also promotion of sustainable, appropriate, and affordable menstrual products and facilities. These products are very, very important, and we want to make sure that they're sustainably available all the time. Also for safe disposal, to ensure that they do not come in on board maybe to harbor microorganisms that are going to cause diseases or any other complications to girls and women, as well as the environment. The objectives of the policies are policy objective one is to establish and enable an enabling legal and regulatory environment for menstrual hygiene management at both national and county levels. You realize that in Kenya, we have a national government and we also have a devolved government. And that is also how the implementation framework is going on. We also have the objective two, where we want to ensure that myths and taboos and stigma around menstruation are addressed by providing women, girls, men, and boys access to information. Remember the culture of silence. The only way we are going to fight that is to demystify these myths and taboos and bring one on board to fight the stigma, and that way everyone can be able to come in and manage this process. Remember, if we have a policy and we are not implementing it at the ground, it doesn't make sense. So our objective three is also to ensure women and girls have access to safe and hygienic menstrual products, services, and facilities. And the policy four is also to ensure clean and healthy environment for all Kenyans through appropriate technology choices for menstrual waste management and pollution control. This is very, very, very much important, more especially in the environment. Some of the places that we were offering these products in our organization was the Masai Mara, which is a home of wildlife and attracts a lot of tourists from across the world. We want to ensure that that environment is well taken care of. Objective 5 is to establish a functionally effective monitoring, evaluation, research, and learning framework for menstrual health management in Kenya, ensuring maximum accountability in policy implementation at all levels. This is to help to really provide information as well as research to provide this data that is able to help us do evidence-based advocacy. The policy context is based on a lot of policies, both national and international. It comes across.
Sorry, Dr. please, you would have a couple more minutes, so you'd have to start wrapping up. Thank you.
Thank you. So we have the national policy being the Constitution of Kenya, the national vision for 2030, as well as the national health policy, all the way to the environment, investment plans, education, and hygiene policies. We also have the international policies, which comes on board with conventions and discussion. One that I'm very proud of is the Beijing Declaration, which brought support the Generation Equality Forum. And today, we celebrate the International Day of the Girl Child. I'm proud to say that the Kenya Menstrual Management Policy has put that into consideration. The implementation framework is very basic. It's coming from on a 5-year plan that is able to help us execute and assess and identify key barriers and challenges in the county, which are the active implementing partners. We also have services and infrastructure necessary for the implement provision being availed to be able to have and to make sure this is availed. There is also making sure the user preferences and barriers to full utilization of existing mental health management policies are being brought on board, and also to bring priorities by itemizing the overall plan to make sure that they provide full menstrual health management policies coverage at the ground. We also want to describe the implementation and financing arrangements for each component, including the private sector participation, to make sure that each plan is very, very well funded. The stakeholders are coming all the way from the relevant government ministries to civil society organizations and partners across the country. The funding is through trickle down, right from the national to the local, government, to make sure that the funding is coming from the Ministry of Finance all the way to the implementing partners. There is also what we are doing as young people, as the Rotary Club of Kikuyu, as well as CSOs across the country. Try to Africa is an organization that you were told earlier. We've been able to reach so many girls, especially this year and also last year. We've been able to provide for reproductive and menstrual health education. Currently, we are working with the Rotary Club of Kikuyu, which has given us an amazing avenue to be able to provide for menstrual health and productive health education, as well as reusable sanitary pads to 2,000 girls in the Masai Mara. So that is what we're doing as the CSOs in the Rotary Club of Kikuyu. What can we do? We want to ensure that we have evidence-based advocacy through increasing research. We also want to increase funding to be able to implement most of these activities. We can also do this by inclusion of girls and women in ensuring tailored policies that are rightful for them. Also for young people, and I'm glad that I'm a young person today, young people, as you were told earlier, are the custodians and the designers of the future that they want. They have to be included in the implementation and also in the formulation of these policies. We also want to build capacities of Rotary clubs and CSOs to deliver and to implement this policy effectively. We also want to simplify the policies into easily understandable, actionable points for all people across the country. We also want to incorporate the mental health, which is really a big aspect of this particular period where it's really affecting the girls. We also want to ensure that we have collaboration and teamwork across Africa. Kenya is very ready to make sure that we are part of this conversation, to make sure that we have an integrated program that helps us improve these policies. Also, to be able to do all that, I came up with a quote that I found online that continues to really motivate me, that you should never doubt a small group of thoughtful, committed citizens can change the world. And indeed, it's the only thing that I ever did. As we continue to partner and through forums like this, we will be able to change the world because we are committed and organized. Those are my references, and thank you so much, with love from Kikuyu Rotary Club in Kenya. Thank you so much. That was my presentation.
Thank you very much, Rotarian Shan. This is just brilliant because it also follows through from the first presentation. You really took us through the policy and also your implementation framework, the key points that came up, the teamwork, the rights to information, access to information, also the budgeting, making sure that it trickles down from the top to the bottom, the issues of privacy, also making sure that it is also linked to the SDGs, and also the inclusion of mental health. This is the first time that I've heard about that. And that is really interesting. Mental health included into all these strategies. And so thank you very much, very insightful. And also we in West Africa will take on your offer to provide the consultancy services to support the Rotary clubs and most of us here who would like to also replicate what is happening, so that we make sure that all our girls and young women have access to the best quality of services. So thank you very much once again. And please stay on, check the chat box. There might be questions there for yourself, so you can also answer them there or wait till the session. Thank you very much. So let's move right along to our next speaker. Okay, our next speaker is, we are moving from East, coming now to West Africa. And we are going to listen to Miss Ellen Jechi, and she is a school health education program, which is SHEP. She's a program officer and is WASH in schools with the Ghana Education Service. Ellen has supported the development of several strategies, SOPs, policies, guidelines, information education and advocacy, social mobilization materials and protocols. She has considerable knowledge and experience in health education, as well as the designing, implementation, and managing of water, sanitation, and hygiene in schools, WINS, and has supported several projects on school health. She is a proud teacher and won the Best Teacher Award in 1998-99 academic year at the Garrison Basic School, Bema Camp, Accra. Her teaching career started in 1995 when she graduated from Holy Child College, Hobson. She holds a Master's of Education in Health Education from the University of Cape Coast and has taken other courses in WASH in schools and menstrual hygiene management from Emory University with support from UNICEF Ghana and New York. She has experience with learners from primary, junior, and senior high schools. She loves children. She's a Christian and a chorister. Some of her projects that she supported and implemented by the Ghana Education Service include school sanitation and hygiene education components of the Danida Water and Sanitation Sector Support Project Phase 2, UNICEF Netherlands Football for WASH projects, and also the Better Life for Girls project with support from UNICEF and COICA. Participants, fellow Rotarians, Rotaractors, and guests, our partners in service, our civil society, kindly help me welcome Ms. Ellen to speak to us. Ms. Ellen, please, the floor is yours. Thank you. You have 15 minutes. Thank you.
Thank you.
Ms. Ellen, it's dark. We can't see your face. We can only see the shadow.
Uh-oh. Please, can you share my screen for me? I'm trying to.
Oh, okay.
Okay,
BJ?
I'm trying.
Yeah, okay. You should have been granted access to do that. Great. It's starting now. Thank you.
Okay. Thank you very much. As Dr. rightly indicated, I'm presenting on behalf of Ghana on this special occasion for our dear school children. Today we joined in the celebration at a district near to Greater Accra region, and I made a presentation on menstrual hygiene management and asked one of the girls to share her first experience. And she indicated that when she first had her menstruation, she thought she had a wound in her vagina, only for her mother to tell her that she's menstruating. And she became very frightened. But with the education now, she has seen it as a natural experience which occurs to every woman. And we are happy about the education we are having for our girls. So this is our outline of presentation, the introduction background, the education strategic goal, the education strategic plan of 2018 to 2030, menstrual hygiene management as part of the school curricular development of MHM communication package, the Be Amazing campaign, outcomes of evidence from a research conducted during the campaign, development of MHM guidelines, key elements of an effective MHM program, and the National Technical Committee, which supports our MHM program. So as a way of introduction, the Ministry of Education through the Ghana Education Service is committed to helping each child achieve his or her highest potential. The ministry, together with other ministries, formulate policies and programs implemented in schools and are therefore aimed at giving the nation's children the necessary knowledge, skills, and values to enable them lead happy and productive lives. This is in recognition of the values of education as a key strategy for advancement of gender equality. We want education to target all children. We are not leaving any child out. This includes boys, girls, the learners with disabilities, irrespective of your political, social, religious affiliations. The government of Ghana recognizes girls' education as part of this agenda. And due to a number of initiatives to pursue this, has established a unit called School Health Education Program, which coordinates health education activities which target girls. The Girls Education Unit, which runs programs for girls to ensure that our girls are retained. And we are now implementing the Safe Schools program, which is led by the Guidance and Counseling Unit to eliminate corporal punishment, sexual harassment, and bullying in schools, as well as inclusive education, which targets learners with disability. The development of policy documents emanates from the Education Strategic Plan, the National Development Plan, and then the SDGs. Despite government efforts, girls in Ghana still face challenges, including those related to menstrual hygiene management. These challenges include low coverage of water and sanitation facilities in some schools, cultural practices and taboos, discomfort and pain, limited access to hygienic absorbent materials, and inadequate information on safe menstrual hygiene management, as well as the risk of being teased by their male counterparts when they soil themselves. This is the reason why now our education is targeting the boys so that they will bear with the girls and support them when they soil themselves or they are going through mood swings. In 2014, Ghana, together with 14 other countries, conducted a study called Wash in Schools, Wings for Girls Project, which showed that girls in Ghana are increasingly finding difficulty to attend school when they are menstruating. WaterAid Ghana also conducted a study in 2012, also reported that 95% of girls sometimes miss school due to menstruation. The education strategic goal, the overall of education sector, is to deliver quality education service at all levels that will equip learners and educational institutions with the skills, competencies, and awareness that would make them functional citizens who can contribute to the attainment of national goals. So the Education Strategic Plan 2018 to 2030, this is the policy goal, which has bearing with water, sanitation, and hygiene, as well as menstrual hygiene management. So under sub-policy objective 2.3, it states that improve learning environments, including health and sanitation, child protection and guidance and counseling in basic schools. The output is to improve water and sanitation facilities to ensure that our girls as well as our boys are retained, and the facilities should be gender friendly with changing rooms to enable girls change comfortably during their menstruation. The strategies here are under 2.3.1. Training will be conducted for teachers, school management committee members, PTA members in local resource mobilization to increase resources for school level health and sanitation facilities. This has to do with proper operation and maintenance. Then under 2.3.3, ensure that there is functioning and maintained potable safe water within 250 meters from basic school sites, that there are adequate sanitation facilities such as urinals and toilets on site, including MHM, especially for girls and female teachers, SMC members in basic schools. MHM as part of school curricula, we have a lot of our hygiene and sanitation topics integrated into the subjects in our school curricula. Some of them are done during teaching and learning. Some are done after school. So for instance, a subject like life skills, we have some hygiene information in it, and menstrual hygiene management is part. Other topics are integrated science, social studies, home economics, welder people, etc. Menstrual hygiene management activities are also done as part of co-curricular activities, especially during school health club activities, during peer education sessions, during children and youth ambassadors for WASH programs, and then competitions, quizzes, etc. And then Menstrual Hygiene Day is commemorated every 28th May, and as a result, we have created a lot of awareness, but still there is more to do. So as I indicated, a study was conducted in 2014 as part of the Wings for Girls project in 2 districts of Ghana, one in the middle and one in the southern and one in the northern. And from the recommendations from the study, MHM communication toolkits were developed. Some of the materials were teachers' manual, flip charts, trifold, flashcards, posters, and a lot of materials to support our MHM education in the schools. And I'm happy to say that our partners have embraced, in fact, they have owned the materials and are using it for MHM education in both in and out of school children. Strategies during that time was to engage young girls and other stakeholders on the issue of, so we have MHM ambassadors. Some are from the media and art industry. We also have traditional leaders who are supporting and championing MHM activities in the communities. We have also developed an MHM website. So if you log on to www.menstrualhygienegh.org, you will find all the communication materials there. And there is also a strategy to advocate for greater investment in MHM for girls through social media campaigns and other influential media outlets and programs. So we rolled out the MHM package from 2014, and an assessment was conducted. We have also launched a Be Amazing campaign during the 2017 Menstrual Hygiene Day. We want our girls to feel confident, to feel tall, to see menstruation as an amazing experience, which will not prevent them from attending school, but rather the enabling environment provided will enable them go to school. So the Be Amazing campaign is to let girls, as I indicated, feel bold, confident, start talk, see menstruation as an experience, amazing experience. And this has been done with support of the National Technical Committee on MHM. Education targets boys so that they will understand and provide the needed support for the girls during menstruation. Some aspects of education or sensitization also targets parents to provide the needed support for the girls during menstruation, and then also for the parents to be well informed so that they will support the girls. I was surprised to hear a girl telling me that she lives with only her father and she has a problem. She menstruates 7 days. One also said she menstruates every 2 weeks, but she lives with her father and not comfortable to discuss with her. So quickly, we referred her to the girls' education and the school health education officers to follow up with the father so that she can be given the right medical treatment. The Be Amazing campaign also tries to enforce the national minimum standards for washing in schools. In fact, we have developed national minimum standards for washing in schools, which indicates the specifications, especially for toilet facilities. So the toilet should be separate for boys, separate for girls. That of the girls should have a changing room with a hand washing facility and some sanitary pad for girls to use during emergencies. Our education, the campaign is also targeting girls to also make their own reusable sanitary pads. This, we have gone very far. Ghana is trying to standardize the use of reusable sanitary pads. So led by the Ghana Coalition of NGOs in water and sanitation, HONEYWAS into brackets, and the National Technical Committee has put a committee together and to work with Ghana Standards Authority and Food and Drugs Authority to support with the standardization of the reusable sanitary pads. I indicated that during the Be Amazing campaign, a study was conducted. And during the study, it came up that there was reduction in number of learners not comfortable talking about menstruation from 21% to 12%, which is significantly good. And reduction in number of boys teasing girls who soiled themselves from 28 to 4%. And there was also increase in knowledge about menstruation from 68 to 81%. MHM package, therefore, has been seen as a useful resource for education for both in and out of school girl child, and as a supplementary teaching material and for a wider community education. So
Ms. Ellen, you have 1 minute to wrap up.
Please,
you have 1 more minute, please, to wrap up. Thank you.
Okay, so we have developed menstrual hygiene management guidelines, which has been launched. And these are a few key elements for MHM program, which I can't go through because of time. Then we have the National Technical Committee on MHM, which consists of partners from Ministry of Gender, Children and Social Protection, Ministry of Education, Ghana Education Service, Ministry of Health, Ghana Health Service, Ministry of Sanitation and Water Resources. We have the Environmental Health and Sanitation Directorate and the Water Directorate, Departments of Children, Departments of Gender, UNICEF, Catholic Reading Services, GAMA, the World Bank, World Vision, Water Aid Ghana, Days for Girls, Global Communities, USAID, Plan International, CAMFRED, and coalition of NGOs in water and sanitation, all supporting to ensure that MHM education and the enabling environment gets to every child, both in and out of school in Ghana. Thank you very much for your attention.
Well, thank you very much, Ms. Ellen, for your insightful presentation. It's great to listen to the various presentations that we've had so far on the policies, what are the strategies, and what is being done and what can be done. We're very grateful, and we hope that the Rotarians, particularly Rotarians in Ghana, who are on this call, can see the opportunities for us to collaborate. We need to see Rotary clubs on the list of stakeholders that are being presented by our various insightful resource persons. I was quite interested in the MHM ambassadors, particularly looking at the ambassadors using the media and then also the arts industry. Our traditional leaders, we need to make sure that we don't exclude them, and our religious leaders. Then also the use of social media to be able to push out the message. So thank you very much. And also not forgetting our boys and our parents, particularly our fathers, and also the long list of members or stakeholders or partners on the technical committee. Let's see how best we can see Rotary names or Rotary clubs also appearing on these on these lists for us to collaborate and partner. So without much ado, I know we are a bit pressed for time. I'd like to move on to our last but one speaker, Mrs. Zandile Masagani. I hope I'm not massacring the names or butchering the names. She's an adolescent sexual and reproductive health coordinator, Ministry of Health, Eswatini. Zandile or Zandile loves adolescents and young people as they are in the center of my heart, as she says, of her heart. Her colleagues describe her as a good listener, very focused, a goal achiever, one who finishes her race by fire or by force. I like that, by fire or by force. She was born in the Mazini region in Eswatini, and she holds a diploma in general nursing, which was obtained from the Southern African Nazarene University, SANU, and the Nazarene College of Nursing. Zandile holds a diploma also in midwifery, also obtained from the same university, and she's a registered nurse midwife. She holds a postgraduate course advanced diploma in healthcare management from the University of Basel, Switzerland in 2021. She has worked for the Ministry of Health for the past 18 years, and she leads and chairs the Adolescent and Youth Technical Working Group, which meets on a quarterly basis. Mrs. Zandile or Ms. Zandile, you are most welcome. Your audience, we are looking forward to listening to you and to keep the momentum going. So thank you very much. You have 15 minutes, please. Thank you.
Thank you very much, Program Director. Good evening, colleagues. Good morning and good afternoon. Yeah. As it has been said, I am Zandile Masangane from the Kingdom of Eswatini. I am the adolescent health focal person, as it has been said. Once again, thank you for the opportunity to present in this forum. I have already been introduced. My presentation outline: there's introduction, background, policies in place, prevailing issues, guidelines for implementation, specific budgetary allocations, designated government agencies responsible and to who they are accountable to, partners in development, key strategies used, and who the targets are. And then I'm going to conclude my presentation. Basically, this is the map of the Kingdom of Eswatini. The total population is at 1 million plus, according to our population and housing census for 2017. And this comprises of 531,111 males and 562,127 females. Generally, it's a female-dominated population. This is according to the statistics. So in introduction, according to the population and housing census of 2017, the adolescent population rate is at 23% of the total population. As I've mentioned earlier on about the total population, this is the adolescent population rate. And then I decided to also break it according to the regions. We have 4 regions in the country. The Hoho region constitutes 22% of the adolescent population, and then Manzini region constitutes 21%, Shiselweni region constitutes 25%, and Lubombo region constitutes 24%. And then the population also, looking at those that are aged 0 to 14 years, they constitute 36%. And those that are aged 15 to 64, they constitute 60%. This is to say that our country is a youthful population. Therefore, it makes sense for us to target our young people with the services that we have. And then those that constitute 65 plus constitute 4%. Our population pyramid also confirms that, as we can see that from the 10 to 14 years up to those that are at least 39 years, basically it shows that this is a youthful population. And then moving up, we can see that mainly the female are more than the males, as mentioned earlier on in the presentation. In background, menstrual hygiene management is a recognized public health issue, as we can all attest to that. Research shows that the realization of human rights are inhibited by lack of provision for MHM, including the right to education, health, and work, according to that. And then also in background, the population, looking at global level, the 10 to 24 years, the population aged 10 to 24 years, they constitute 24.7%. And then in sub-Saharan Africa, they constitute 33%. And then in Eswatini, they constitute 32.5%. This is according to our youth population, our youth policy for 2020. This is the kingdom with the 4 regions. And then those that are aged 15 to 35, they constitute 38.9%. As mentioned earlier on, this is a youthful population. In background, we have limited support for menstrual hygiene management generally among school girls, and this may result in 4 to 5 days of absence from school per month. This could mean adolescent girls lose 10 to 20% of their school calendar time. It is estimated that almost 70% of the world's 130 million out of school youth are girls. And this makes sense for us to focus on the adolescent girls. In light of these unnecessary challenges, girls, the United Nations in 2014, we all know that it declared May 28th of every year as Menstrual Hygiene Day. Maybe it's worth mentioning that in the Kingdom of Eswatini, basically, when we look at MHM, we are still at infancy stage of implementing MHM. So we haven't gone that far. We started to have much focus in 2020. So background in Eswatini, menstruation is highly taboo in Eswatini and can lead to social isolation, crushing accusations, and physical hardships. Menstruation is not openly discussed, and this leads to passing on of myths and misinformation about menstruation from generation to generation. Sanitation infrastructure at all levels, including households, schools, workplaces, everywhere where there are adolescent girls and young women, including public spaces, does not accommodate safe and decent menstrual hygiene management. So we have limited menstrual hygiene management friendly toilets at all levels. The policies in place to support the implementation of MHM in the kingdom, we have the National Health Sector Policy of 2016 to 2024. This policy basically focuses on ensuring that there is a reduction of morbidity and mortality generally, and it also, the main objective of this policy is to promote health and prevent diseases, also strengthen health systems, capacity, and performance, and it also improves access to essential, affordable, and quality health services. So this improves also the accessibility to MHM by the adolescent girls. And then basically these, the focus for this policy is to promote quality of health at key stages of life, which also accommodates the adolescent stage, and then also taking into account the need to address social determinants of health, gender equity, and human rights. We know that MHM is basically a human right. We will always say that SRH rights are human rights. Then we have the MHM Baseline Assessment Report, which was conducted in 2020. Basically, this report has given us some insight in terms of where do adolescent girls and young women access, where do they access money to purchase their sanitary pads. Some of them, they do get money from their parents, but some of them, they do plate people, they do this and that also to get money in order to purchase their sanitary pads. And then we have the National Sanitation and Hygiene Policy, which was developed in 2019 with guidance from the Environmental Health Program. And then the National Sanitation Hygiene Strategy, it's a 2019 to 2023 document that we are also currently implementing. And then we are having the Sexual Reproductive Health Policy, basically which talks to comprehensive sexuality education, and ensuring that our young people are informed so that they are able to make informed decisions in every stage of life, especially in adolescent health stage. And then we have the MHM guidelines for 2021. These guidelines basically are going to help us as a country to implement across all sectors, ensuring that we promote the lives of our adolescent girls, reduce morbidity and mortality that might be related to infection, maybe ascending during menstruation. So we are also having our reproductive, maternal, child, adolescent health and nutrition strategy for 2019 to 2023. This one specifically prioritizes adolescent health, of which we know that when we prioritize adolescent health, we are also looking at the sexual reproductive health and rights, which also prioritizes MHM for our adolescent girls. And then the National Health Sector Strategic Plan, 2019 to 2023, we are currently implementing this strategic plan, and the focus is ensuring that we increase accessibility to friendly services by our adolescents, cutting across in all healthcare facilities, in public health facilities, and in non-governmental healthcare facilities. And then we have the National Youth Policy, which prioritizes sexual reproductive health and ensuring that we reduce also the early and unintended pregnancies amongst our adolescent girls, and also empower them with life skills, even if they are out of school. And then we have the education sector policy of 2018, which talks to inclusiveness of the learners in schools, and also prioritizes the care and support for teaching and learning, ensuring that healthcare issues are taken care of for our learners in schools, cutting across and managing MHM in schools. And then we are having international and regional agreements, which may include Maputo Plan of Action, the Sustainable Development Goals, the ICPD, which we know that it prioritized sexual reproductive health, and also recognized and prioritized that when we provide services, we must ensure that the services are friendly as they are provided to our adolescents and youth, and also provide a friendly information to them so that we increase accessibility to services. And then the prevailing issues that accounted for the evolution of policies. School-going girls are mostly affected by menstrual hygiene management, friendly toilets shortage. Some school girls opt to miss school when they have their menstruation because their schools do not have either water or decent toilets, and they cannot afford sanitary materials. Disabled females of reproductive years almost suffer double, as the basic toilets at school does not accommodate people with disability generally. We can all attest to that many of our toilets in schools do not allow the wheelchairs, for example. This includes the disposal of used sanitary materials and accessibility to people with disability. Where are they going to dispose of their used sanitary materials? There's a lot of supporting partners who wanted to introduce the reusable sanitary pads, and this also helped us and pushed us to come up with policies that will target MHM, so that we talk about the policies, we promote the lives of our adolescent girls and young women, we ensure that we reduce morbidity and mortality amongst our adolescent girls and young women, as we know that if they use reusable sanitary pads, we have to get standards to ensure that these reusable sanitary pads are clean, and we do not have such standards. This may put them at risk of ascending infection, which may later on lead to pelvic inflammatory disease, to mention a few. Then places of MHM-friendly toilets. Where do we need this MHM-friendly toilets for our adolescent girls and young women? Basically, we need to have such toilets at home, at household level, because we know that our adolescent girls spend more time maybe in their households, especially during school holidays, at school, because we know that they spend more time during their school days. Yes, they do menstruate, and so we want to have schools that have MHM-friendly toilets. And then at work as well, we have seen young women suffering because there are no MHM-friendly toilets in their workplaces. So this is where we want to see MHM-friendly toilets, and these prompted us to come up with the guidelines so that we can ensure that at workplaces, the MHM-friendly toilets are prioritized. At health centers as well, because we know that our people, our young people, adolescent girls and young women, they do visit our health centers even during menstruation. So we also need to have MHM-friendly toilets, even at health centers, in primary healthcare facilities, in public spaces as well, because we know that they migrate, they move from places to places. So we need to ensure that they do have access to MHM-friendly toilets. This is according to our baseline assessment report, the menarche versus age. We have seen, that many of our adolescent girls, they reach menarche early. So we need to target them with the right information, correct information on MHM, so that they are able to make informed decisions, and they are able to take care of themselves during menstruation, and they are able to dispose of sanitary pads during menstruation in a safe way. Excuse me. Guidelines for implementation. We have the menstrual hygiene management guidelines for 2021. We have just developed them. We have just finalized them and they are ready for printing. We will soon start implementing them. We will orient everyone, the healthcare workers on the ground, all the other people that are implementing MHM, including guidance officers from Ministry of Education, so that they can implement these guidelines. And then we have the adolescent sexual reproductive health guidelines, which have been recently reviewed in 2021. These guidelines are prioritizing youth-friendly service provision. And then amongst the elements under these guidelines, we are also prioritizing MHM. And we also have indicators under these guidelines to track for MHM at a facility level, health facility level, at regional level, and at national level. And then we are having our AHA framework, where we are accelerating action for the health of adolescents. We are prioritizing MHM under this framework. We are ensuring that we attend to the adolescent in a comprehensive manner. We even prioritize mental health for the adolescents, and we didn't mind whether they are in school or out of school. We are targeting all adolescents. We are just saying, let us accelerate action for the health of adolescents. So we are also prioritizing MHM under this framework. And then we are having the care and support for teaching and learning guidelines in school.
Sorry for interrupting. You need to wrap up now, please. You have 1 more minute, please. Sorry, this is Gertrude.
And support for teaching and learning guidelines in school. We call them Ingaba, our local name. Basically, we are implementing them, targeting all adolescent girls, and they are prioritizing health issues for the learners in schools. And then specifically budgetary allocations. Domestic budget, we have none. I said we are at infancy stage of implementing MHM in the country. And then MHM initiative, we are donor dependent currently. Designated government agencies responsible, we have the Sexual Reproductive Health Program, which houses the adolescent health component, which prioritizes youth-friendly service provision, and then the Environmental Health Program, which also leads in ensuring that we are having friendly toilets on the ground, MHM-friendly school health program, Ministry of Education Guidance and Counseling Unit. We are basically focusing on the adolescent girls, promoting their lives. These are the partners in development: AHF, Rotary Club, Surface, UNFPA, UNICEF, WHO. The list is endless. Key strategies used: we are having collaboration, which we are having a technical working group at national level, where all partners present, and we plan together and focus, prioritize MHM, advocacy for zero-tax MHM, and then evidence-based programming. We have the assessment, we have the guideline that we are currently using as we are implementing. So it's high time government allocate funding for MHM. Donors, development partners, and UN agencies should prioritize financing and technical support for MHM at national level. I thank you.
Wow, thank you very, very much, Zandili. This was really brilliant. I like the fact that you said that you are at the infancy stage for the MHM, and at the same time too, you are a youthful population, a youthful country. So we wish you all the best as you start your journey or as the journey goes on. And you have the amazing support from Kenya, from Uganda, from Ghana, and all that. So let's work together, collaborate. And I was very happy to also see that Rotary clubs are part of your partners. Then also using Rotary clubs and all others to push, to advocate, to allocate adequate and sufficient funding for you to take this to the next level. Congratulations and thank you very much for the very informative and insightful presentation. So we'd now like to move on to our last, okay, our last speaker, Vijay. Our last speaker. Okay. Apologies also because we are running a bit out of time. So if you can just bear with us. So we'd like to move on quickly to our last speaker. So we are coming back to West Africa. And Dr. Edmond Indibuga is a consultant public health physician from Enugu State University Teaching Hospital in Nigeria. He qualified as a medical doctor 34 years ago. And for the last 20 years, he has been specifically devoted to public health practice, consultancy, research, and teaching. His academic qualifications include, I don't know all of them, but includes public health and is also in terms of the West African College of Physicians, an MBA. He is a lecturer at the University College of Medicine and is a founding chairman of the Board of Trustees, administrative lead of ESUCOM Healthcare Delivery Research Initiative of the university. He's also the pillar lead focal person of Enugu State COVID-19 Emergency Operations Center, Infection Prevention and Control pillar. He is a Rotarian and has been a Rotarian for the past 26 years and counting. He served as a club president for 2 years. In Rotary, you typically serve for 1 year. He served for 2 years, assistant governor for 3 years, district polio plus chair for 2 years, and Enugu State polio plus representative for 11 years. And he's also currently serving as a cadre member. Participants, Rotarians, Rotaractors, our partners in service, our development partners, civil society on the call. Kindly, let's welcome Dr. Edmond to take us through what is happening in Nigeria, in Enugu State. Doctor, are you on the call, please? The audience is yours. Thank you. Hello, doctor, we cannot hear you.
Dr. Edmond, you are unmuted. You can speak, please.
Hello, we cannot hear you, doctor. Hello. Okay, we can see you now, but we cannot hear you, Prof. We still cannot hear you. So whilst we're waiting for Prof for us to be able to hear him, if you kindly have any questions or comments, kindly type them in the chat box And as much as possible, our resource persons are still here with us. They can respond to some of them. And we would also have a very brief session on questions and answers and comments. So please go ahead and interact with our 4 amazing speakers so far, and I can provide you additional insights. Thank you very much. Prof, we still cannot hear you. Okay, we just heard you.
we can just take up the questions in the meantime till I think Dr. Edmund gets his connection right.
All right then. Okay, so I'd like to now quickly call on Rotarian Baptista. Rotarian Baptista of the Rotary Club of Tema Community 25, Ghana, District 9102. Can you kindly take us through any questions or comments that have popped up in the chat box whilst we wait for Prof to be able to, for us to hear him. Thank you. Rotarian Baptista, thank you.
Thank you, PAG Ajo. For now, what seems to have come in through the chat box is more of a comment. We heard from Takas. Takas sent in this, and he is of the opinion that apart from we having dialogues as Rotarians, we need to work in the area of creating awareness about the myths that usually surround period issues. And aside that, he also added that we need to do some physical work, and he proposed the installation of pad vending machines and insinuators in all schools where girls could be found. So this is not a question, this is more of a comment from him. And then there was a question that came in from Diane Tete. She asked, what really is Rotary Club about and how does one join in? Over to you, PAG Ajo. Thank you so much.
Thank you very much. Thank you very much, Rotarian Baptista. Yes, please. Prof, we still cannot hear you.
Baptista, there's one question that has just come out on the chat box. If you can just take it from Roxanne.
I'm using this now.
PAG, you can take it up that question.
Hello.
Yes, okay. Prof, is that you? Is that Prof Eddie?
Yeah, can you hear me now?
Yes, we can hear you now.
Okay. I'm so sorry about this.
Okay, please kindly go ahead because we have very limited time now. Thank you.
Okay, so I'll quickly go. My presentation outline, introduction, current situation in Nigeria, availability of policies, guidelines, and all that. But most of these things we've already talked about, so I will skip them. And then,
okay.
You see my screen?
No, please. Hello? Your screen is not. We don't see your screen.
You're not seeing my screen?
No, please.
Right. Oh, God of mercy. Well,
if it's going to be a challenge, you can start presenting, and then later on we can share the slides with the presenters.
I think so. I think that's what I'll do.
Yes, please. So please go ahead. Yes, thank you very much.
Okay. Well, incidentally, in Nigeria, we'll quickly we've already done the introductions about what menstruation is and all that. But I just want to know that most of our girls menstruate between 12 and 13 years, although we have some going as low as 8 and 9 years. But some countries are unaware of this important milestone. We've already had that. So for the unprepared and uninformed female, menstruation is commonly associated with dirty malodorous,
Okay, Prof, we've lost you again. It looks like there are some technical challenges. So, and also we are also running out of time. So, Prof, we've lost you now. We can't hear you at all. Pipi Nana, please, what would you recommend we do? Because we are also running out of time. We have only 5 more minutes.
PAG Edzo, you can take up that question that is there on the chat in the meantime.
Please allow screen sharing for Roxanne.
It is allowed, PP Nana. He is a co-host. We are not stopped.
He's a co-host. They've all been made co-hosts. It's not a question. Rotary Baptista, please can you go through the questions to see what is there and what can be answered? We have till 6 o'clock. Others have expressed they have other meetings to attend. So let's see how best we can manage the time. Rotary Baptista, could you kindly go on? Thank you.
Thank you so much, PAG Ajo. So back from the chat room, we have a question from Auntie Ellen. Auntie Ellen, the question is coming in from Rotarian Roxanne, and this is his question. He says, what is the level of implementation of the strategies, looking at 3.21, 2.3 for the basic education policy objectives? And he's very specific, this goes to the Ghana presenter. Auntie Ellen, enough to support us with the answer to this question. Thank you so much.
Thank you so much. There are a lot of reforms taking place in the Ministry of Education and Ghana Education Service. And I am confident that these strategies have been implemented to about 50%, or I will verify, because the policy was revised in 2018 to 2030. So implementation is so ongoing. And I believe that by the mid-year, we will get the desired results. Thank you.
Thank you so much, Auntie Ellen. Over to you, PAG Ajo. First questions and that of the
Okay, thank you very much. Thank you very much. Okay, Prof. Okay, so we need you to go through quickly because we just have about 5 more minutes left. Yes, because quite a number of people have logged off because there are other sessions. So we'll leave you to kindly try and present quickly in 5 minutes, and we need to wrap up. Thank you very much. Hello, Prof. We still cannot hear you. We cannot hear you. Prof, unfortunately, we cannot hear you. We can see your slides, but unfortunately, we cannot hear you. I don't know what else we can do. We are also working with time, and we have actually gone over our time. So I do not know what has to be done now, but it's just quite unfortunate because we would have really loved to listen to you or to hear you. So maybe let's give another minute to see if we can hear you, or you can just, I don't know, maybe show the slides or something.
Professor, can you check your audio connection, please? We cannot hear you.
Yes, we can't. That's what I'm saying.
You are visible, but we cannot hear you. Please check your audio settings.
And whilst we are waiting for that, we have another question from Francis Rotary Baptista. Can you?
Thank you so much. So another question just came in from Francis. Francis says, a number of countries seems to have developed guidelines and policies, but he has observed that they are provided to a supplementary of whatever guidelines seems to have been put in place. So his question is this: how to make our government respond in this area? Thank you so much, Francis.
And I see that Zandili has responded. And can you read the response, please, Rotary Baptista?
So His response is advocacy is the key, which means this program is very helps create the awareness. And once we are aware of these situations, we need to put in the advocate for our government to put in the right systems, approve the right budget, to enable us to overcome the challenges. If then these problems will start staring us at the face. So if you thank you so much for putting that response in. We appreciate that.
Okay. I see Rotary Leshan's hand is also up. Rotary Leshan, can you kindly make your submission or your response?
Yes, thank you. That is a very, very important question. Thank you so much, Francis. Funding is very, very important to be able to do anything, especially on policies that are quite important like this. I will say that an approach would be to do evidence-based advocacy through doing research and coming up with information that is actually able to compel the government to act. Secondly, we need to master, the budget process of your government. That way you are able to come in at the right time and advocate for. Sometimes we have a lot that that is important, but we come at the wrong time. I think when we have data and then we have the right leaders through using the right pathways, we can be able to find the government at the right time and advocate and tell them the importance of funds to be able to achieve this. Otherwise, it's very, very important to have funding for policies to work.
Thank you very much, Rotary Leshan. Rotary Baptista, I think I saw another hand up, but the hand has gone down. It was Elizabeth.
Professor Eddie is trying to speak, but we are not able to hear him.
Yes, we can't
audio
hear him. That's why we're still.
There's some issue with his audio settings. We cannot hear you.
Yes. And Miss Ellen too also has included, also provided some additional information that also when the budgets are allocated, the allocation should be released timely. That's also another thing. One thing, budgeting and having an allocation, but another thing with regards to the disbursement and the timeliness of that. So thank you very much for your responses and also for your questions. PP Nana, you need to advise us on what exactly we should do now, because it's past 6 o'clock and it's unfortunate that we will not be able to have our last speaker. And so if you have any additional questions or comments, kindly raise your hand or put it in the chat. So Prof, if you can hear us, we see your presentation. So unless you just want to scroll through the slides, but it would be good to really hear you and to hear your voice. It's unfortunate, it's really unfortunate. So I think we need to put you up for the next session. So
yes, PAG. I just spoke to him. I think he thinks it's the network. I just spoke to him.
Okay.
So he has agreed that we go on without him.
Oh, okay.
Time is against him, so maybe some other time.
Okay.
Yeah.
All right. Okay. Thank you very much for that feedback. So I see 2 hands up. We are actually running out of time. And so can you kindly be brief so that we can wrap up? So I'd like to call on Elizabeth. Rotary Baptista, I cannot hear you or see you. So I don't know whether you are still on the call. Are you still on the call?
Yes, I'm still on the call.
Yeah, so please kindly take us through the last 2. Let's do this in the next 2 minutes so we can wrap up because there are club meetings that need to start. Thank you.
Okay, so thank you. Let your hands up. You have the floor in just 1 minute.
I cannot unmute myself. Okay,
we can
hello.
hear you.
Please.
Yes, thank you. I just want to say this was a wonderful forum. I'm so glad I came. I want to acknowledge all our speakers. I mean, so much to share. It's impossible to receive their presentations, copies of their presentations.
Baptista, can you mute, please, because you have a lot of background noise from your side when the person is speaking. Thank you. Okay. Yes, please just go ahead, Madam Elizabeth.
No, I ended by asking if we are going to receive copies of these presentations.
Certainly, yes, you would. It will be shared with all participants.
To be registered as from the Rotary Club of St. Paul, Liberia. Thank you.
Hey, Cinco. Pipinana, please take notes. We have another participant who would like to join our Rotary Action Group, MHH. Yeah. Baptista,
so
Rotary
much.
Baptista. Okay, you're most welcome. Please kindly go on.
So next is Francis. Francis, you have the floor and you have just 1 minute. Your time starts now.
This is Mojeni from the RC Kawempe in Uganda. Mine is a major comment that it is important to have national budgets, actually funding from inside the country rather than relying on external funding. So our advocacy should really work on our national governments, put in the money because the people we are serving belong to that country itself. Thank you very much.
And the last president.
I see Madam Evelyn Isaacs. She's raising her hand, but she's raising it on the screen. So if you can kindly request her to.
Please go ahead.
Thank you very much. My question is similar to what was just said, because having worked with governments, they do not really want to put money into reproductive health that really includes anything that sounds like it's sexual orientation or sexual management. But that has been a long problem. What we should do, I think, as Rotarians, is find out how we can assist the governments to make sure, and the other partners, to make sure when we are sitting down to write policies, these policies are part of the government. It is not looking like if it's our policies as outsiders. We need to learn from the Rotarians how they did it in other countries, so that we now, I'm no longer in the hands of the international group, WHO, but I'm in the hands of Rotary. And we would like to support. So please let us work together and find out the best strategy to help countries to get this on the road. It's a long, long study, long. We need to do it. Thank you.
Thank you so much. So we have Rotarian Judith, Edith. You have the floor. Just in a minute, please ask your questions.
Thank you so much. I would like to thank you all for such a wonderful presentation. Thank you to the panelists. And as Rotarians, I would like to encourage us to continue advocating for sexual reproductive health rights, for reproductive health rights, for MHM rights. And if we can raise our voices and have our governments actually reduce the taxes they impose on the MHM products, so that girls, young girls, teenagers, mothers and young mothers, poor mothers can be able to afford MHM products at the lowest price possible. But I am very happy that we honored the International Day of a Girl Child in a very special way. God bless you, and I bring you greetings from the Rotary Club of Sunday. Thank you very much.
Welcome. Thank you so much. We still have President Linnea. Please, you have a minute since our time is fast spent. Please give your comment very brief. Thank you. You have the Linnea, you have the floor. If you can hear me, please unmute.
I can't.
Yes, we can hear you. Please speak.
Can you hear me now?
Yes.
Yes, please.
Okay, good evening, good morning, and good afternoon. My name is President Neina Lemomo from the Rotary Club of Mikocheni, Dar es Salaam. Mine is a comment question, and It's we see a lot of NGOs, I believe in many parts of the world, distributing free condoms. Can't we not try to have the same policies made for free sanitary towels, especially in schools? That's my question and comment.
President Lina, you may have to speak to the corporates who normally sponsor all this. And in India, we have been doing this quite a lot. There also, I think you can do that. Or in fact, rather than distributing, you can have those vending machines installed in the school, which are sponsored by the corporate. So the girl child can take advantage of this in the school.
Thank you. I see that Ms. Sandini's hand is up.
Yeah, thank you so much. President Lerimo, did I pronounce the name correctly? But I think we can start by maybe advocating for tax-free sanitary pads before we move to having free sanitary pads, because it cannot be a once-off. We can start with a tax-free and then move to the free sanitary pads. We can move step by step so that we are able to achieve our goal. That's my thinking. Thank you so much.
Thank you very much. So, okay, Batista, okay, please go ahead. We are wrapping up. We can't take any more questions or comments. This is a forum that we're going to continue. So kindly put any questions or comments in the chat. We are well over time. So we'd like to say thank you very much for joining us for the last almost 2.5 hours for the insightful presentations to all our panelists, our resource persons, and also, great. Okay, to all our resource persons, our panelists, also all the participants, be you a Rotarian, Rotaractor, be you a partner in service, a donor, a civil society, government, and if we had any other entities on, thank you, thank you, thank you. Let us move from this forum to action. And let us also collaborate as Rotary clubs, as Rotaract clubs, to push the agenda and to push this to make sure that as we honor or commemorate this International Day of the Girl Child, we move from talk to action. Thank you all so much. And we wish you all a good night. And I would like to now call on Pipidana. Can you just say a few words so we wrap up? Thank you very much. Thank you very much.
Thank you.
Thank you very much. Yes.
Thank you.
Thank you very much, AJ.
Oh, we can hear Prof now.
Hello.
I'm so sorry. I just apologize. It's network problem. Please, we'll schedule.
Yeah,
thank you so much.
Will.
Thank you.
Thank you, Doctor, and everyone.
Yes.
Thank you so much. Thank you from Eswatini.
Okay, I
Good
just
night.
want to wait a little. I just wanted to say that this is just the beginning. With level, we need to start going down at the country level, at the club level, inter-clubs, and so on. We now have to digest what we came and heard and look internally and see what we can make of the presentations that were made. We've seen people we can now contact and network with, and we should continue the discussion from here. It should not end here. I'm going to talk about the Rotary Action Group on menstrual health and hygiene, but the time is not the right, I mean, considering the time, this is not a good time to do that. So those who are interested in joining, please, I put my name and, well, not my name, but I am sure the name shows. I put my address and phone number down so you can get in touch with me and we go on from there. But please, we've seen all, participants, let's interact. Let's get together from here and continue the discussion. We'll see when we can do it and have everybody talking. Prof, we are so sorry. We really would have loved to hear from Nigeria. You represent such a huge population, and it's a pity that we couldn't hear your submission.
It's okay. It was internet issue. It was internet. Thank you.
Thanks all the same. And thank you everybody for great presentation, great inputs from the floor. It's been a real great pleasure being with you these 2+ hours. Thank you so much and have a good evening, everybody.
Thank you so much and have a good evening.
Good night. Good night, everybody.
Okay.
Hi,
Good night.
Leshan.
Good night.